being able to enjoy the foods that you absolutely love. It goes on, but Dr. Larry Stroud knows all about this. I say often on this show when you're on, I say, throw away your dentures. And I think, boy, that must be a nice feeling for folks, because a lot of times I hear people complain about they don't fit right, I don't get to eat what I like, it's a lot of hassle. And when you tell folks you can throw those away, what kind of response do you get?
Well, at first they don't believe me.
Really?
How easy it can be, that they could actually be rid of their dentures, you know, because that involves the traditional way of doing that with the surgical implants. I mean, it's a big deal, go through all kinds of surgery. But now with the mini implants, you know, we've talked about it many times on here. We can actually do this procedure now where, in fact, the case we're going to show today is a lady where I can actually take someone from a denture to just have their teeth that stay in, and like 2 visits and no surgery and no stitches or anything, and actually just have teeth. You know, no plate, no plastic in your mouth anymore. Your teeth are just there and they just stay there. You don't take them out. You go out and eat, do whatever you want, go on vacations. Your teeth are just there.
So it's just like having real teeth. There's no plate, no nothing, no dentures, nothing.
Closest I know of how we can do to just actually having your teeth back. So it's been a pretty neat thing, and patients are really liking it, and it's you know, it's life changing.
And you've done this thousands of times. This guy was on the cutting edge without cutting. He was on the edge with mini dental implants. There's no cutting involved here, and we're going to show you this case. This young lady's name is Iris. So again, I'm going to ask you, Dr. Stroud, to do the play-by-play. There's Iris. She's a pretty lady.
Iris Browning, great lady. Really, kind of sad story. I mean, Iris had, you know, had really bad teeth during her life, and had ended up just gradually losing all her teeth. And then, you know, went to dentures, or tried to go to dentures, but she couldn't wear them. She's got a really bad gag reflex, you know, like a lot of people do. A lot of people come to me with that really bad gag reflex. They can't wear that denture at all. And so, you know, her life was just, she wouldn't wear her teeth. She could not wear her teeth. So she wouldn't, I mean, she literally wouldn't go out. She wouldn't go to the grocery. She wouldn't go out to eat. She told me she actually even turned down a cruise with her daughter to the Bahamas because she was, you know, embarrassed about her smile and didn't have her teeth.
Now that is sad.
And,
I love cruises. That's sad.
I mean, wouldn't go to family get-togethers. You know, wouldn't do pictures. I mean, she said that she told me basically just had no life whatsoever, and just pretty much just a hermit. About the only time she would go out would just like maybe to go to a doctor's appointment or something.
Which is a shame, because she's a pretty lady. Yeah, it's a shame.
She's a great lady. So she came to me, and we talked about the options and stuff. And we did this procedure for her, like we were just saying, where we just gave her teeth back, where they just stay in. Now here she is after.
Okay, we're going to flip it out. Now looky here.
She's smiling.
Yes.
She's smiling.
And then she has a beautiful smile. So this changed her life, not only from an appearance level, but the confidence, you know, self-confidence. A lot of everyone should be able to smile.
I mean, this was just dramatic for her, because she had no teeth and literally wouldn't leave the house. And now she says now I'm not scared to go anywhere. She said, I go anywhere I want. I hold my head up. She says she has a lot more confidence, feels a lot better about herself, says she's back to eating anything she wants to. In fact, she said the first thing she did after the procedure that day, when we actually put her teeth on, she said they went to Cattleman's and she ate a steak. That's what she said she did on the first day. She probably
missed those steaks, because that's tough for people with dentures, isn't it?
Oh, it's impossible.
Yeah.
It's impossible. So she's got a lot more confidence. She just said, she said, you know, I'm just so thankful. You know, I have my life back. You know, it's like a dream come true. And she just said, this is the best thing I've ever done for myself. And it's, you know, our family's happy, and she's happy, and it's just, this has really been one of those life-changing kind of stories, you know.
If you're just now tuning in, Dr. Larry Stroud, he comes on every now and then from Mini Dental Implant Center, and I want to show you what's different about this. Now, previously, back in the old era, and people still do this, it involved a lot of cutting of the gums and surgical procedures. It took a long time for everything to take place. If you would, with these models, show them exactly what Iris had done and how it's different.
Well, all right, here's the gum, okay? We'll just pretend this is a person's gum.
So no plate here.
This is a model. This doesn't go in your mouth. This is pretending it's the gum. Okay. What we do is we put in these mini implants. Okay. They're kind of like long, narrow screws. We put in about 10 or 12 of these mini implants.
No cutting.
This is for the denture wearer that wants to be rid of their denture. This is exactly what we did for Iris that we just showed. But what's different about it is the way it's done versus the other surgery implants. You know, the only other way that they do this stuff that the surgeons do, and that's what was taught, and that's what the way they were trained, and that's what worked for years and years, and they still do that. Involves a lot of surgery. You go through several surgical processes with different doctors where you're put to sleep, cut open, put implants in, sewn up, and then later when that's healed, go to another doctor, cut open again, sewn up, and you can have that done, but it's a lot of surgery and very involved. So anyway, if we can get back to this model, with the mini implants, we just put in these little implants. You have these little screw things that sort of stick out. But there's no cutting on you. People are wide awake when I do this. All I'm doing, there's some little pinches where I just numb the top of the gum a little bit, make these tiny little starter holes, and then the implants actually screw in. They immediately tighten up into the bone. They have to go in and tighten into the bone. People don't really even feel that when I'm putting them in, but all those implants go in, and then we have a new set of porcelain teeth made. If you can sort of see that, it's just teeth. There's no plate. There's not going to be any plastic or anything like that. And then these teeth cement onto the implants all at one time, permanently. And the teeth just stay there. Now these never come out. There's nothing, there's nothing in the roof of your mouth. There's no plate. There's no plastic. There's no plastic up here under your lip. There's nothing to take out and clean. There's nothing covering your mouth. You still taste your food fine. No adhesive, none of that kind of stuff. So, and you can see that, like with ours, with nothing in there, there's nothing to bother you or to gag you, and so it allows you to wear your teeth. Now, this is done actually in like 2 visits. One time we put in the implants, and the second visit we put their teeth on there. So 2 visits in about 3 weeks without going through any surgery or anything, and people are literally rid of their denture and just have their teeth in. Back to eating pretty much everything they want to eat. So
well, I have medical experts on the show all the time, and everything in medicine seems to evolve. A lot like glasses, and now there's contacts, and then there's LASIK, that kind of thing. Same is true in the dental world. This is the latest and the greatest, the best way to do it, and it's also, by the way, more affordable than the other way. Obviously, less pain, no cutting. So what's the downside of this? That's my question. With many dental implants, tell me the bad news.
Well, that's funny, because after I do this for people, and we talk about this, or I do it, they say, well, why would anybody want to do the other? When your choices are, you can spend more money, go through a lot of extensive surgical procedures, or you can spend less money and go through a quicker, less invasive procedure.
Okay.
So which do you choose?
I think that's a no-brainer to me. Okay, again, Mini Dental Implant Center of Louisville. We encourage you. If you'd like to give us a call, 571-5263. This isn't just for all of your teeth. Maybe you have a bridge, perhaps just a couple of teeth that need fixing. Hey, he can do that. Fixing. Best word I can use, fixing.
Fixing.
All right, fixing. He can do that. Dr. Larry Stroud is with us. We'll take your phone calls next, and we'll talk more about Mini Dental Implant Center of Louisville right here on Wave 3 Listen.